Hey everyone, and welcome to another deep dive. Today we're taking a closer look at a topic that's, well, pretty essential. Artificial airways.
Oh yeah, definitely essential.
We'll be exploring what they are, why they're needed, and just how many different types there are out there.
You might be surprised by the variety.
For sure. And, it's something you might actually encounter or at least see in your daily life. So I think it'll be really interesting to get a better understanding of these life-saving devices. So to kick things off, could you give us a basic definition of what an artificial airway is?
Sure. An artificial airway is basically any medical device that's used to keep the airway open, to make sure air can get through. It's like creating a clear path for airflow when the normal route is blocked or compromised for some reason.
Okay, that makes sense. But why would someone need an artificial airway in the first place? I mean, what are the situations where this becomes necessary?
Well, there are a few main reasons. The most common one is to relieve an airway obstruction.
So like if someone's choking.
Exactly, or if there's swelling that's blocking the airway. But it's not just about obstructions. Artificial airways can also be used to help clear secretions, kind of like unclogging a drain.
Oh, I see.
And they also protect the lower airway from aspiration, preventing things like food or liquid from getting into the lungs.
Right. That's super important.
Absolutely. And we can't forget about their role in helping with positive pressure ventilation. You know those machines you see that gently push air into the lungs?
Yeah.
Well, they need a secure airway to work properly, and artificial airways provide that. And lastly, certain types of artificial airways, like endotracheal tubes, can even be used to administer medications directly.
Wow, I had no idea they were so versatile. It
Yep.
sounds like they're essential in so many different situations.
Definitely. They're a crucial part of emergency and critical care.
Okay, so we've got the basics down. Now, let's dive into some specific types of artificial airways. I think most people have probably seen or at least heard of oropharyngeal airways. They're the ones that go in the mouth, right?
Yep, that's right. They're pretty common. You often see them used in movies or TV shows during medical emergencies.
Exactly. So how do they work? What's their main function?
Well, their primary job is to keep the tongue from blocking the airway. You see, when someone's unconscious, their muscles relax, and the tongue can fall back and obstruct the airway. An oropharyngeal airway basically holds the tongue forward.
Oh, I see. So that's why they're mainly used on unconscious patients.
Exactly. You wouldn't want to use one on a conscious person because it would trigger their gag reflex.
Yeah, that makes sense. I've also heard there's a specific way to size these airways, like measuring from the corner of the mouth to the jaw or something.
Yeah, that's a common technique. Medical professionals use those anatomical landmarks to estimate the right size for the patient.
Okay, so don't try this at home, folks.
Definitely not. But getting the size right is super important. If it's too big, it could actually worsen the obstruction by pushing the tongue back further. And if it's too small, it might not be effective at keeping the airway open.
So how are these airways actually inserted?
There are two main ways to do it. One involves using a tongue depressor to hold the tongue down while you slide the airway in. The other technique is to insert it upside down and then rotate it 180 degrees as it goes past the uvula.
Interesting. Sounds like there's a bit of finesse involved.
There is. It's important to do it carefully to avoid any complications like gagging or even aspiration if the patient isn't fully unconscious.
Right, so proper technique is crucial. Now, are there different types of oropharyngeal airways, or are they all pretty much the same?
Actually, there are two main types that are commonly used, the Berman airway and the Guedel airway.
Okay, so what's the difference between the two?
Well, the Berman airway is made of hard plastic and has grooves along the sides which allow for suctioning. The Guedel airway is made of a softer material and has an opening in the center also for suctioning.
I see, so it's all about choosing the right tool for the job.
Exactly. The choice between the two depends on the specific situation and the patient's needs.
So oropharyngeal airways are for the mouth, but what if you can't use one for whatever reason? Like if the patient has a clenched jaw or something.
Right. In those cases, you'd likely use a nasopharyngeal airway. These are inserted through the nose.
Oh, like a nasal swab, but it stays in.
Exactly.
I bet you need a good amount of lubrication for that.
It's added. Lubrication and proper technique are essential. The airway is inserted parallel to the floor of the nasal passage, aiming towards the back of the head.
Okay, so not straight up.
Nope, definitely not straight up.
What are some things that could go wrong with this type of airway?
Well, you could get some nasal bleeding, and there's a risk of irritation and even infection if the airway isn't changed regularly. And just like with the oropharyngeal airway, sizing is super important. If it's too small, it might not be effective and could even increase the risk of aspiration.
Right. So we've covered the basics, the oropharyngeal and the nasopharyngeal airways. What's next on our airway adventure?
Let's move on to laryngeal mask airways, often called LMAs.
LMAs. Okay.
Think of them as kind of a mask on a tube that sits over the larynx, the voice box.
So they're not going down into the trachea like an endotracheal tube.
Nope. They sit above the trachea, creating a seal over the larynx.
Got it. So where are these typically used?
They're really common in operating rooms and are super helpful in emergency situations where intubating the patient might be difficult or take too long.
So it's all about speed and ease of use in those situations.
Yeah, pretty much. LMAs are generally much easier to insert than endotracheal tubes and don't require you to move the patient's head and neck around as much. And they provide a more secure airway than the basic oropharyngeal or nasopharyngeal airways we talked about earlier.
That makes sense, but I'm guessing there are some downsides to using LMAs as well, right?
Of course. No airway device is perfect. LMAs aren't really meant for prolonged mechanical ventilation, and they don't completely eliminate the risk of aspiration.
Okay, good to know. So what about those situations where even an LMA isn't a good option? Are there any other tools that can be used in those critical situations?
Yep. In those really tough cases, there are some specialized airways like the esophageal tracheal Combitube and the King airway. These are both designed for emergency airway management.
These sound pretty intense. Tell me more.
Both of these are what we call blind insertion airways.
Blind insertion, what does that mean?
It means the person inserting the airway can't directly see where it's going. So the Combitube, it has this unique design with two lumens and cuffs that inflate to seal off either the trachea or the esophagus, depending on where it ends up. And then there's the King airway, which is designed to mainly sit in the esophagus. But the key with both of these is that you absolutely have to confirm placement once it's in.
Wow, blind insertion. That sounds a little nerve-wracking.
It can be. But these airways have some big advantages in emergency situations. They're much easier to use than traditional intubation and don't require any special equipment other than the airway itself.
Oh, I see. So that makes them super valuable in pre-hospital settings or in areas where you might not have a lot of resources.
Exactly. They can really be lifesavers in those situations. They offer some protection against aspiration and can be used to help with positive pressure ventilation.
So they're like a bridge to more definitive airway management.
Exactly. A temporary solution until you can get the patient to a place where they can receive more advanced care.
That's amazing. But I imagine there are some downsides to using these airways as well, right?
Of course. As I mentioned, confirming placement can be tricky, and they're really only meant for short-term use. There's also a risk of aspiration when you take them out.
Right. Makes sense.
Plus, suctioning through them can be difficult, and with the Combitube, there's a risk of injuring the esophagus if it's not placed correctly.
Okay, so they're not without their risks, but it sounds like they can be real game changers in those emergency situations. All right, we've covered the basics, the LMAs, and these emergency airways. Now, what about endotracheal tubes? These are the ones we often see in movies, right? The ones that go all the way down into the trachea.
Yep, you got it. Endotracheal tubes are definitely more advanced. They bypass the mouth and throat completely and go directly into the trachea.
Okay, I'm ready to learn more about these. What are the key components of an endotracheal tube?
Well, they've got a cuff, which is like a little balloon that inflates to seal off the trachea and make sure that all the air delivered during ventilation goes straight into the lungs. And they have a Murphy eye, which is a small hole on the side of the tube that acts as a backup airway if the main opening gets blocked.
Wow, so many little details.
Yeah, there's a lot to them. They also come in different sizes to fit different patients, and they have a radiopaque line that shows up on x-rays, which helps doctors make sure it's positioned correctly.
Okay, so when are endotracheal tubes typically used?
Lots of situations. They're essential for relieving upper airway obstructions, things like laryngospasm or epiglottitis. They also help protect the airway during medical procedures, especially when the patient's unconscious. And they're really important for providing mechanical ventilation when someone can't breathe on their own.
Wow, so they're truly life-saving in some cases.
Absolutely. They're like a lifeline in critical care.
This has been an incredible journey so far, learning about all these different types of airways.
It really is amazing how many options there are.
And I can't wait to explore even more about these fascinating devices.
Me too. We still have a lot more ground to cover. Welcome back.
It's great to be back, ready to delve even deeper into the world of artificial airways.
We've talked about quite a few types already, from the basics to those specialized airways for emergencies.
It's amazing how each type is designed for specific situations and patient needs.
Exactly. And it's worth remembering that this field has come a long way. We've gone from using basic tools like, straws and quills to these sophisticated devices we have today.
That's right. It's incredible to think about the ingenuity and innovation that has gone into developing these life-saving tools.
For sure. Medical professionals throughout history have been constantly looking for better ways to help patients who are having trouble breathing.
So we've covered the basics, the LMAs, those emergency airways, and even endotracheal tubes. What's next? Are there even more specialized types of airways we haven't discussed yet?
There are. Let's talk about tracheostomy tubes. These are typically used for longer-term airway management, often when an endotracheal tube has been in place for a while, more than a few weeks.
Oh, okay. So they're kind of like a more permanent solution.
Exactly. They're surgically inserted through an incision in the trachea, creating a direct pathway for air to bypass the mouth and throat entirely.
Wow, so it's a direct line to the lungs. That sounds pretty major.
It is a surgical procedure, but for patients who need long-term airway support, it can be really life-changing.
I can imagine.
Yeah.
So what are the key components of a tracheostomy tube?
Well, similar to endotracheal tubes, they have a cuff to seal off the trachea for ventilation. They also have a one-way valve and a flange that sits on the outside of the neck to hold the tube in place.
So they're similar to endotracheal tubes in some ways, but they're designed to stay in place for much longer.
Exactly. And one of the big advantages of a tracheostomy tube is that it makes it easier for the patient to swallow and eat, which can really improve their quality of life.
Oh, that makes sense. Being able to eat normally would be a huge plus for someone who's had to rely on a feeding tube.
Absolutely. It can make a big difference.
Okay, so we've got tracheostomy tubes. What about those laryngectomy tubes you mentioned earlier?
Oh, right. Those are used after a laryngectomy when the larynx is surgically removed.
Right, I remember. So what's the purpose of those tubes?
Laryngectomy tubes are shorter than tracheostomy tubes, and they don't have a cuff. They're inserted into the stoma, the opening that's created in the neck after the surgery, and they basically help keep that opening from closing up during the healing process.
So it's more about maintaining that opening than providing ventilation.
Exactly. It's a temporary measure to ensure the stoma heals properly.
Got it. We've covered a lot of ground here, from basic airways to these specialized tubes. It's amazing how many different devices there are to meet all these different needs.
I know, right? And we haven't even talked about the most futuristic sounding airways yet. Double lumen endotracheal tubes.
Oh yeah, those sound straight out of science fiction. Ventilating each lung independently.
Exactly. That's what makes these tubes so unique. They have two separate channels, each with its own cuff. One channel goes into the left or right main bronchus, and the other sits in the trachea above the carina, which is where the trachea splits. And each channel can be connected to a separate ventilator.
Wow, that's some serious engineering.
Yeah.
So when would you need to ventilate each lung separately? I mean, why not just ventilate both lungs together?
Well, there are a few reasons. Sometimes you have a patient with a lung disease that affects only one lung. In those cases, you can use a double lumen tube to deliver targeted ventilation to the healthier lung. They're also really important for managing complex situations like, bronchopleural fistulas or disruptions in the tracheobronchial tree, things like that.
So they're kind of like the special ops of the airway world, ready to handle the toughest challenges.
That's a great way to put it. They're also frequently used during certain types of surgeries, like lung removals or esophageal resections. They help isolate the lung that's being operated on and protect the other lung from, blood or secretions.
Okay, so they're like a highly specialized tool for specific situations.
Exactly. And this brings us to a really important point about airway management. It's not just about having the right tools, it's about knowing when and how to use them effectively.
So it's kind of like a combination of art and science.
You got it. Medical professionals need a deep understanding of anatomy and physiology, as well as a mastery of different techniques to make the best decisions for their patients.
They're not as simple as just sticking a tube in and calling it a day.
Definitely not. They need to be skilled in a whole range of techniques, from basic airway maneuvers to more advanced procedures like intubation and tracheostomy tube placement.
And they have to be able to handle unexpected complications and work as part of a team. Sounds like a really demanding job.
It can be. But it's also incredibly rewarding. Knowing that you have the skills to help someone breathe when they can't on their own is an amazing feeling.
I bet. It's literally life-saving work.
It is, and it's a field that's always evolving, with new technologies and techniques emerging all the time.
That's exciting. So what's on the horizon for airway management? What kind of advancements are we likely to see in the future?
Well, one area that's really promising is the development of less invasive airway management techniques. Researchers are exploring new ways to secure airways using flexible endoscopes and other devices that are less traumatic.
So it's about finding gentler ways to achieve the same life-saving results.
Exactly. And there's also a lot of interest in personalized medicine approaches, tailoring treatments to individual patients based on their specific needs and characteristics, using genetic testing and other tools.
Wow, that's incredible. It sounds like we're moving toward an even more precise and personalized approach to airway management.
We are. And I think these advancements have the potential to really revolutionize the field and improve outcomes for patients.
This has been an eye-opening deep dive into the world of artificial airways.
I agree. It's been a fascinating journey.
We've explored the history, the different types of airways, the skills involved, and even the future of the field.
And we still have more to uncover.
That's right. We've laid the groundwork, but there's still more to learn. Stay tuned as we wrap up our deep dive into the world of artificial airways, exploring the cutting-edge technologies and innovations that are shaping the future of this critical field. Welcome back to our deep dive into the world of artificial airways. We've covered a lot of ground, from the history and different types of airways to the incredible skills required to manage them effectively. And we even got a glimpse into the future of the field.
Right. We talked about some pretty amazing advancements that are on the horizon.
Yeah, it's mind-blowing to think about how technology is changing the way we approach airway management. Speaking of technology, you mentioned earlier that double lumen endotracheal tubes sound like something out of science fiction.
They do, don't they? But the line between science fiction and reality is getting blurrier all the time, especially in medicine.
That's for sure. So what other futuristic advancements are we likely to see in the field of airway management?
Well, one area that's generating a lot of excitement is robotic-assisted airway management.
Robot-assisted. Wow. What would that even look like?
Imagine robots, guided by skilled medical professionals, performing those really delicate airway procedures with incredible precision.
Okay, now that sounds like something straight out of a movie. But seriously, what are the potential benefits of using robots in this way?
There are quite a few. For one thing, robots could significantly enhance precision and dexterity, allowing for more complex maneuvers that might be challenging for human hands.
That makes sense.
And they could also reduce surgeon fatigue, especially during those long, complicated procedures. Plus, robots might be able to access areas of the airway that are difficult to reach with traditional tools.
So are we talking about robots eventually replacing human medical professionals in airway management? Is that where this is headed?
That's a great question, and it's one that comes up a lot when we talk about robotics in healthcare. But in my opinion, robots are much more likely to assist and augment human capabilities rather than replacing humans altogether.
So it's more about collaboration than replacement.
Exactly. Think of robots as highly advanced tools that extend the reach and capabilities of skilled medical professionals. The human element, the expertise and judgment and compassion, those will always be essential in airway management.
I'm glad to hear that. Technology is amazing, but it's the human touch that really makes a difference in healthcare.
I agree. Speaking of technology, another area that's advancing rapidly is the use of artificial intelligence in airway management.
AI in airway management. Okay, now I'm really intrigued. What does that involve?
Imagine intelligent systems that can analyze patient data, monitor vital signs in real time, and provide guidance to doctors and nurses during airway procedures. These AI systems could help identify potential complications early on, optimize ventilator settings, and even personalize treatment plans.
Wow, that sounds incredibly futuristic. But are there any potential downsides to using AI in this way? I mean, it sounds almost too good to be true.
Well, as with any powerful technology, there are always potential risks and challenges we need to consider. One concern is the possibility of bias in AI algorithms, which could lead to disparities in care. And we also need to be careful about becoming too reliant on our technology, making sure that it doesn't erode human skills and judgment.
So it's all about using AI responsibly and ethically, making sure it benefits everyone.
Absolutely. We have to prioritize patient safety, equity, and the preservation of human expertise as we integrate these new technologies into airway management.
Well, this has been an absolutely incredible deep dive into the world of artificial airways. We've learned so much about the history, the science, the challenges, and the exciting future of this field.
I agree. It's been a fascinating exploration.
We've explored the amazing variety of airways out there, from the simple to the incredibly complex, and we've gained a real appreciation for the skills and dedication of the healthcare professionals who use these tools to save lives.
It's been a true deep dive, covering everything from the basics to the cutting edge.
And it's clear that this field is constantly evolving, driven by the desire to provide the best possible care for patients. But as we've seen, airway management is about so much more than just the tools and technologies.
That's right. At its core, it's about that human connection, the compassion, and the unwavering commitment of those who dedicate their lives to helping others breathe.
Beautifully said. It's a powerful reminder that even in the face of all these technological advancements, the human element remains at the heart of medicine. Thank you so much for joining us on this incredible journey into the world of artificial airways. We hope you've learned something new and are as inspired as we are by the ingenuity and dedication of those working in this field. Until next time, stay curious and keep breathing easy.